the last session on the fifth day of International Webinar Series on applications of Ayurveda, medicine, and technology to combat COVID-19, organized by IQAC, Department of Botany, Chemistry, and Zoology from GFGCVB, Vijayanagar, Bangalore. To begin with, I would like to respectfully and cordially welcome our beloved principal, Dr. Subaramesh, who is known among us for her wisdom and knowledge. She is the driving spirit behind all our academic activities. On behalf of convener, coordinators, and organizing committee, I extend a warm welcome to you, ma'am. And secondly, it's my honor to extend a special welcome to our today's resource person, Mr. Parag Chatterjee, who is going to deliver a lecture on applications of artificial intelligence in medicine. On behalf of principals, convener, coordinators, organizing committee, and all participants, I wholeheartedly welcome Parag Chatterjee, sir, to today's International Webinar Series. I would like to extend a warm welcome to the convener, coordinators, and organizing committee of the International Webinar Series. It's my pleasure to extend a special welcome to all the participants who have joined this International Webinar Series. On behalf of the principal, the convener, coordinators, organizing committee, and staff of GFGCVB Vijayanagar, I wholeheartedly welcome each and everyone for the fifth day of International Webinar Series. Dear participants, I would like to introduce the resource person, Mr. Parag Chatterjee. Parag Chatterjee works as a researcher at the National Technological University, Universidad Tecnológica Internacional in Buenos Aires, and serving as an assistant professor at University of the Republic or Universidad de la República in Paysandú, Uruguay. Parag Chatterjee current research is focused on the interdisciplinary areas of Internet of Things, artificial intelligence, and data analytics applied to healthcare, especially in cardio, metabolic, and chronic diseases. He is an associate editor of Internet of Things journal Elsevier and member of the editorial board of several international journals. He is the editor of the book, The Internet of Things, featuring 21 chapters by authors from more than 15 countries, published by Taylor and Francis. Apart from serving the reviewer and the editorial boards of several international journals and technical programs, committees of several IEEE international conferences, Parag Chatterjee has delivered keynote lectures and invited talks at reputed institutions like University of Rome, Tor Vergata, Indian Institute of Science, IISc Bangalore, and Pavaloro University and University of Republic in Uruguay, and at events like Expo Internet Latino America, Argentina, IOCV Geneva at Switzerland. Currently, he is working on designing an inclusive Internet of Things system for prevention and analysis of disease. With this brief introduction, I would now request Parag Chatterjee sir to deliver his lecture. Over to you, sir. Thank you.
Thank you very much, ma'am, for your kind introduction. I must say it's a real honor and pleasure for me to be here with all of you virtually, sitting almost close to 15,000 kilometers away from India. So it's a real pleasure for me for sure. So, well, in today's talk, what I thought is to show you some basic things, some interesting aspects of artificial intelligence and how we can apply those things in different domains. I think these days, let's say last 3 months or 4 months, or rather this entire part of the year, there is one thing which connects us very much: the COVID-19, the pandemic. And because of this pandemic, I think there are a lot of sharing, a lot of movements, a lot of discussions across the world, and it's an amazing opportunity to take advantage of. So in this talk, as I was saying, the idea is to talk about a little things of artificial intelligence or the technological advances, and not just in the domain of COVID-19, of course, that's the top priority above anything else, but how it can guide the entire domain of healthcare. The funny part is that, well, in Argentina, I work in the university as a research professor, but that's pretty much distributed. In Uruguay, I work in the Department of Biological Engineering. but I don't teach biology. I teach in health informatics, the informatics domain. And frankly speaking, I said goodbye to biology in my class 10, the 10th standard. After that, I was studying computer science. So the interesting part here is that still there is a common platform for different disciplines and different minds to share, to collaborate in academia. To start with, I wanted to show you, okay, is there anybody who can identify this person? Well, in the chat, you can type. Anybody? This famous person. Darwin, no, it's not. It's not Darwin. Well, never mind. This person, yeah, you're right. Leonardo da Vinci. Great, amazing. Yeah. Well, if you're just pondering how to recognize this person, well, you can just open up your Google app, fire it to the screen, and in a few seconds it will tell who this person is. And that's artificial intelligence. I think these days we are talking a lot about, let's say, the different disciplines which are, let's say, coinciding a lot. Why I put forward the aspect of Leonardo da Vinci? You know, there is something in the city of Florence, Italy, a very beautiful city. Almost, let's say, 500 years back or even more, because last year we were celebrating the 500 years of death of Leonardo da Vinci across the world. So in this city of Florence, there was a family, Medici family, and this family, the kings, they basically patronized the art and culture a lot. So because of their patronization, their support, there were many things which came, let's say, art, the opera, there are the beautiful architectures, the piano, all these things were invented by the support of this family. So what used to happen in those days in this famous city of Florence, Firenze, in Italy? So all these people, let's say, the scientists, the philosophers, the doctors, the painters, the artists, the poets, everybody would communicate together, would sit together in the same table and talk and discuss and share their ideas, their thoughts, their inventions among each other. And because of that, we really got amazing outputs. Like Leonardo da Vinci himself, you know, he was a very talented person. We just cannot call him just engineer or just artist. He was such a multidimensional person. So that effect, that all these doctors, scientists, artists, philosophers coming and sitting in the same table and talking, was actually the Medici effect. Now, fast forward to recent times. Over the years, there has been a lot of transformation and towards specialization, a lot of specialization. That's a very specific topic, specific domain. And now these days, we are talking again about the multidisciplinary, or let's say the interdisciplinary topics. So the idea of this discussion is taking further to transdisciplinary topics, where it's not just sharing a common area, but the disciplines or the subjects basically fuse among each other. There can be different subjects like mathematics, statistics, biology, chemistry, computer science, philosophy, art, history, culture. So all these domains were pretty much different than each other. The transdisciplinary concepts say that, well, you need to go back to 500 years, be like those people in Florence, in Italy, and talk among each other. Be it doctor, be it a chemist, be it an engineer, be it a mathematician, they should talk. Because by this sharing, some amazing things can come out. Now, in this intersection comes artificial intelligence. Artificial intelligence is such a field which is basically connecting all these fields. it's providing the platform, let's say the playground for all these different disciplines to interact, to talk between each other, to find something common between each other. And that's the beauty of artificial intelligence. And well, as I was saying, right, I said goodbye to biology years back. I studied computer science. My background is from computer science. But now I'm working in the domain of healthcare. And that's fascinating because when I'm working, I have, let's say, well, I have biological engineers beside me. I have computer science or informaticians around me. I have doctors. I have statisticians. I have visual artists around me in the same table, in the same place. And we talk, we work together. And I think that's the possibility which is given by artificial intelligence, because artificial intelligence, let's break the myth. It's not just a computer science discipline. It's not just a statistics discipline. It's for everyone. Everyone has something to do in artificial intelligence in these days. And I think that's a really amazing thing, because it gives all of us from all disciplines a good scope to contribute something, to be a part of this movement. So what is basically artificial intelligence? Well, let's try to think it this way. We are trying to making our dumb computers or dumb devices intelligent. So should they think like human or act like human? Well, not essentially. The replication is a good thing. For example, you had birds. Now you made aeroplanes. But do aeroplanes have wings which flap? No. They use the similar principle, but it's not a replication. It's an advanced inspiration and a new creation. So whenever you try to compare artificial intelligence and human intelligence, always think about a bird and an airplane, how they're similar and how they're different. So the idea of artificial intelligence is something like that, well, if we can do something better than the human intelligence, or with respect to the power, because computers really have enormous computational power, far more than the humans. So how we can take advantage of that computational power to do something more. So that's more or less the idea of artificial intelligence. It was 2015, yeah. I was finishing my master's thesis from St. Xavier's College, Kolkata. And well, I had to choose a master's project, and I was really not sure, because in computer science, there are so many topics, you really get crazy to choose one. That time, I don't remember where exactly, an incident happened. I saw in the news or somewhere, a baby, a little baby, was playing in a house, in the backyard of a house with a swimming pool, and the baby was not attended by anyone at that moment. The baby accidentally fell into the swimming pool and drowned. So that caught my attention, because the house, the swimming pool, was armed with cameras, with security cameras, with CCTVs. So I was surprised that, well, we have so many cameras that are watching in the swimming pool, but still a baby fell and nobody knew. There wasn't any alarm, there wasn't anything. So that was my, let's say, the first entry point to think about artificial intelligence. I started to think, how can we make these cameras a little more intelligent, so that the camera can also give an alarm if somebody else is drowning in the swimming pool. Well, that's a long story. So then I designed something like that, and well, it worked somehow. At least it worked for my project. And but the idea is something like this, that try to think that we had cameras, we had CCTVs, but they're just recording the scene. You still need a human sitting in this maybe 10 screens or 20 screens to watch 24/7 to that how the things are happening. So the idea of artificial intelligence is that how can we make those cameras smart? So this is just a very basic example. Talking about artificial intelligence, you can find it basically in every aspect of life, everywhere around. Be it your, let's say, the Netflix you watch, the shopping you do, the Google search you do on the internet, then the transportation, the traffic system, the artificial intelligence is basically everywhere. And I was saying that was the beauty of artificial intelligence, that you can apply it in multifarious domains, even in the field of history, like for deciphering rocks, for reconstruction of old structures. Everywhere artificial intelligence is helpful. So talking about artificial intelligence, it has a very fundamental backbone, a skeleton, a structure. And that backbone is data. This data is very, very important. Everything basically contains data. In the field of artificial intelligence, in this field, there is a common saying which says that data is the new oil. Why? Because the petroleum, the oil, was so paramount in making the industrial revolution. So now I think there is a lot of saying that with the artificial intelligence, there can be the industrial revolution 4.0. So it's really amazing that how this entire domain of artificial intelligence is based on the backbone of data. And as we're saying, that data is very much like oil. Like, you can have data everywhere, or even if you get data, you need to clean it, you need to process it, you need to make sense out of it. So that's like the oil, that you need to process, you need to clean it, you need to purify, and then you get the best part of the oil. So data is very fundamental in this domain of artificial intelligence. So if you are thinking that how we can construct an artificial intelligence, well, first you need to focus on the data, how we can make data or get data. And this is very interesting because data is being generated everywhere at every moment. Even if this Zoom meeting we are doing, the bandwidth, the rate of the speech, and the participants joining, the geographical locations, there are so many data associated to just a single Zoom meeting. Now imagine all of your activities. There's so much data, but almost the major part of the data we are wasting. We cannot make sense out of data. We are making sense of a very small part of that data. So artificial intelligence focuses exactly on that part, how to make sense of this data. So that's the reason I was saying that data is the new oil. So talking about artificial intelligence, there is a small, the most principal domain of artificial intelligence is machine learning. So machine learning is basically like you teach the machine. You teach the machine, and well, the process works like this. You have a data, right? A data set. It can be anything. So you take the data, you clean the data, you pre-process the data, and you try to look for patterns, for relationships, for some significance in the data. And once you find that, you try to analyze the patterns, find more patterns, and teach the computer that, or the computer tells you the patterns automatically. And the idea is to make sense of the data. You make more sense of the data by analyzing it, by finding patterns, by learning from the data. So that is, this machine learning is very, let's say, the principal part of artificial intelligence, because this is the part where we actually take advantage of the computational power of the computers or systems, and we take advantage of that to process our data. There is another aspect, another domain I must speak about a little bit. Why? Because this domain is very much related to artificial intelligence, and especially in the field of COVID-19, this field of Internet of Things, or IoT, is so important. In fact, I'm writing a paper on this. In last couple of months, I think there are more than 30-40 publications just saying how IoT, Internet of Things, can be useful in COVID-19. There are more, like so many publications, because researchers across the world are finding a way to join the revolution. And remember, COVID-19 is not always about the healthcare personnel. Well, they're the principal personnel, of course, they're working in the front line, but there is so much background work related to it. there are researchers sitting in a lab but still working, it can be really amazing to contribute that way. So Internet of Things is another domain which stands very much familiar with the COVID-19 aspects in the recent times. So what it's all about? Internet of Things is basically a platform, I would say, or let's say interconnections between a set of objects, set of devices. So these devices are not ordinary devices. These devices have some power to acquire data, power to capture data, power to understand what's happening around the devices. So if we plant some sensors, maybe a temperature sensor, maybe a light sensor, so that sensor will tell us the ambient light around the sensor or the temperature around the sensor. So immediately the thing that was just a dumb thing converts to a data collecting object. So this is the first component of Internet of Things. Secondly, you have networks, a lot of networks, that how these devices talk between each other. Because I can have this smart pencil, I can have this cell phone, I can have this iPad, I can have this maybe a smart glass over there. So these devices are heterogeneous objects. So how they will talk between each other? So there should be a network, some platform, some connections, right? And then comes the data. The objective, as I was saying, the backbone of everything is data. So the data is another, let's say, pillar of Internet of Things. And finally, you have people. People are, well, this changed over the last decade, I would say, because, or last 5-6 years even, it's very recent, because previously, when we used to talk about Internet of Things, we used to think only about devices or smart devices, smartphones, smart things. But these days we are talking about people also, how we can integrate the technologies more around people. We can make people a part of the technology. So that's all about Internet of Things. And this has been very helpful in the domain of COVID-19. Well, I will tell you how in a few moments. But as I was saying, the objective is, so I think by now you have a basic idea what artificial intelligence is and what Internet of Things is. So here, as I was saying, in the artificial machine learning part, there are usually two ways to teach a machine. And well, no, it's not a very easy task, because it's not like that kid whom we can say, okay, this is this. It's not like a kid. It's very often difficult to teach, because why? The humans sometimes learn without knowing. It's just intrinsic in the nature, in the systems. But computers are dumb in that way. So we need to teach it explicitly. So the first domain of teaching or learning, I would say, the computers is the supervised learning, where you basically give the computer a lot of examples, like, okay, this is big, this is big, this is small, and based on those examples, the computer generates a perception of what is big and what is small. So then, based on that knowledge, you can give some unknown sizes and ask the computer to determine if it's big or small, based on the knowledge you fed to the computer. There is also another aspect. For example, here you can see there are some points, some data. So supervised learning will try to find the equation of this data set. Why? Once you have the equation of this data set, you can extrapolate the equation line on either sides. So what you will get is basically the trend of the data. You get a trend, and that trend will tell you about the future, what the future data can possibly be. So what you are getting is the possibilities or probabilities of the data depending on the trend which you have obtained from the information you already have. So this is, let's say, a brief part of supervised learning, and then comes the domain of unsupervised learning. Here, you not essentially need to tell the computer everything. You just feed the data and just teach some basic ways how the algorithms should work. And the computer will work based on that. So here, for example, you can see you have a spreading data. So you feed this data to the computer, and based on some algorithms, the computer can tell you that, well, here there are 3 clusters, where in some places you see the cluster is mixed, but still there are 3 clusters the computer can determine. And it's very easy for you, because imagine for a human to computationally find the center of each cluster is pretty difficult, it's pretty complicated. And imagine here, this is a small data. Now imagine hundreds and thousands and millions and billions of data. So it can be really, really tough. But a computer can do that for you, taking advantage of its computational power. So unsupervised learning is essentially this, that where you don't need to label or tell all the details of the data, but the computer will find the patterns, or let's say the groups among the data based on some fundamental algorithms. So now let's take a look how all these concepts or principles can be actually applied to the field. Let's see this video. By this time, I think we are all so familiar with these kind of graphs, like thanks to these COVID-19. Here, for example, you can see it's a graph about in Argentina, about the social distancing. And well, Argentina till now, it's especially in the city of Buenos Aires, the capital where I live, it's still continuing its lockdown, and to keep a check in the number of cases, in the number of infections, because the neighbors are pretty much complicated, like Brazil or Chile. It's really complicated. So it's the case, and that's the reason there is strict social distancing. And here you can see that how the things came down, how the mobility changed with time. Here is another graph. This is a graph about the confirmed infections, and also the number of tests and the estimated infections. Now here is something, let's say, very interesting. Try to see that there are some dotted lines. So those dotted lines basically tell you about the estimated infections, the future, about the future it's telling. So this is also a very interesting aspect of COVID-19, I think we all are pretty much familiar about. Well, in Argentina till now, there are pretty much cases are going up, but right now I'm in Uruguay. And here, well, there are more or less, well, Uruguay is a very small country with only less than 5 million population. So it's nothing. It's even less than the city of Bangalore. So it's basically nothing. But so the cases are pretty much less here. And the deaths are also very less. I think that the total cases will be even less than 1,000 or something. So it's really better here in Uruguay. Here, for example, well, this graph, I think this type of graph is very famous. We talk about flattening the curve. So yeah, this is the curve which we essentially flatten. The peak, as you can see, that the number of deaths per day, they augment and then they come down. And the idea of physical distancing or lockdown is essentially this, how to flatten this curve. Here also you can see that there are some predictions of death. Well, it's not like astrology prediction of death. This is scientific prediction of death. So here you can see that based on different algorithms or intelligent algorithms, it gives you the predictions or the progression of the number of deaths per day, how it will look. It will predict, it will give you a probability. And based on that, you can let's say, take different things or understand how the complications are going on. So these graphs, I think, are pretty much familiar. So now I will show you some of the, let's say, very, very easy applications or very simple applications, how artificial intelligence has been helping or has been contributing in almost everywhere in the world without just making it very evident. Contact tracing. So how do we trace the contact, or how do we understand that, okay, these contacts have been, or let's say, how the thing is happening, the thing is spreading? I think you have all heard the term of hotspot across different cities in India. There have been different hotspots. How to detect the hotspots? So these are typically called tree or graphs in the language of computer science. So in that case, you essentially design this kind of structures, and based on that, or you remember the photo of this image of the clusters in unsupervised learning. I was showing that three clusters could happen. So the same way, when you map the cases in the geographical basis across the entire country, artificial intelligence can easily calculate for you or find for you the hotspots, the containment zones. These things are exact applications of artificial intelligence in the domain of contact tracing. So this is, let's say, a very, very common application, or a very common area where these days artificial intelligence is being applied in COVID-19. Second, I think this is also another interesting aspect, the clinical decision support system. I think, if I don't make a mistake, the name of the app in India was Arogya Setu or something like this. So, well, in different countries, they made some apps like that. In Argentina, we have an app called Cuidar, means in Spanish to take care. And well, so these apps, what they do, it helps you to self-diagnose your problems, your issues, if you have a risk, if you pose a threat of contamination. So what it does, it guides you through a decision process. Let's take a very, very simple example. If I have a flu or a fever, something like this, in normal times, not now. If now it's complicated if I have a fever, but in normal times, imagine a year back. So what will I do usually? I will go to the doctor's chamber down the street, and what the doctor will do, she will ask me some questions like, okay, first she or he will check the fever, then we'll ask that, okay, how long are you having the fever? Then, okay, do you have cough? Do you have cold? Are you sneezing? Are you having a headache? Then if you're having a headache, how long? So then the doctor will check my mouth, maybe, or something for some other symptoms. So what you will understand, what to take from here is that, try to see that there is essentially a decision process based on yes or no. You have fever? Yes. How long? 1 day, 2 day, 3 day, 4 day. There are different options. And based on these options, you essentially reach your diagnosis. What artificial intelligence does, it tries to replicate, to transform this sort of decision-making process inside the computer in an intelligent way. So essentially in these applications during the times of COVID also, it tells you, it helps you, it guides you through this decision-making process called decision trees, because the structure here, you can see, if you invert it, to tilt it, you will see that it looks like a tree. So it guides you through the decision-making process, telling, okay, if you have symptoms, what symptoms you have this, yes or no. If you have this, yes or no. Based on this, it will give you a result, an output, which in most cases is pretty much similar to what a doctor will give. This is very helpful, especially in at times. Now I think it's clear to everyone that the healthcare systems across the world is facing tremendous pressure because of this COVID-19. Why? First, the new patients they surged really high. And not only that, in COVID-19 cases, you need to take care of several sanitary protocols, hygiene protocols, waste management protocols. Those were very, very stringent in hospitals. So because of that, and apart from that, there was a shortage of medical staff as well across the world. So that's the reason here comes the artificial intelligence, which helps to pre-diagnose yourself using these artificial intelligent tools like decision trees, so that you can you can take a look how the thing is working. Or before going to a doctor, you can, let's say, have an idea of the scenario. And this is very interesting in cases where you need to actually detect early, because here you can see there are two approaches. In the traditional approach, you need to wait for the symptoms, you need to visit a doctor for the symptoms. On the contrary, in the artificial intelligence based approach, first you will automatically get a notification, get an alert if you are at risk of being touched or coming close to some already contaminated person. And based on the artificial intelligence decision trees, it will automatically guide you through a series of symptoms, and just by choosing yes or no or some answers, it will come to a conclusion very fast, much earlier than the traditional way. And there lies the fundamental way of applying artificial intelligence in this domain of COVID-19. There is another, let's say, very, very popular or very interesting thing. As I was saying, the COVID-19 has changed many things in healthcare. I have been working in, well, apart from the university, I work in a hospital as a part of the project, in a military hospital here. And many things have changed during the times of the pandemic, including, let's say, now, for example, here in Argentina and Uruguay, these two countries, if you have some symptom, it's always recommended that you don't come to the hospital. There is a helpline number you can call, and there will be ambulance very soon to your house, where there will be doctors who will test you, will check you to avoid the contamination in healthcare facilities. Because of this pandemic, there is a group of patients who suffered. How? This group of patients didn't have coronavirus, didn't have this disease, but they had other complications. In normal times, they used to visit the hospitals every 2 weeks or every week, once a week or once in 2 weeks or 3 weeks. Now they cannot, because they're advised to stay at home because hospitals are, let's say, having higher risk of contamination than the home. So, but these patients needed some monitoring. Their healthcare conditions need to be monitored. How? Well, here in Argentina and Uruguay, a lot of hospitals have started the teleconsultation, that you can consult through video conferencing. A doctor will sit and like that. But then also there are different barriers, like sitting across the screen, the doctor won't be able to know the heart rate of the patient or the blood pressure of the patient. So the blood glucose level of the patient, the doctor won't be able to know these things normally. So here comes the devices, the Internet of Things, the IoT devices, which are essentially the smart devices which collects your information and can send electronically in a summarized way to the physician, for the physician to analyze. So now the physician can have you in a screen and your data in another screen. So the physician can ask you just the symptoms, and checking with the data, the physician can diagnose you much, much better. And this monitoring, this remote monitoring, is getting a lot of boost these days, thanks to, let's say, this situation where, let's say, it's advised to reduce the hospital visits of people. So there comes remote monitoring, if you can monitor a patient over distance, over video conference, but not just call, not just talking, also getting some idea of the health parameters. And there comes these devices. There are a lot of devices. For example, just with this watch, you can do an ECG. So imagine doing an ECG at home, checking the heart rate, checking the blood glucose level. Those are pretty much the principal diagnostics you need to send to a doctor if in some minor situations. And the doctor, instead of just listening your symptoms, now will have a valid data beside her or him to match with your symptoms and, let's say, treat you better in a more efficient way, so, or personalized way. So there lies the key of this remote monitoring, of using artificial intelligence and Internet of Things in these times of COVID-19, why it received a push. Another thing I think we are using a lot these days, as I was saying, the projection of cases and mortality, how the graph will look like, how to predict that if this is the trend of the number of cases and based on the measures, remember, it's not just the number of cases. There are so many factors involved. There can be hundreds and hundreds of factors involved. So thanks to artificial intelligence, it's very much easy to integrate these factors, these things inside the entire domain of COVID-19. So considering these factors, it's easy to predict or easy to project the number of cases, the mortality. And so this is, let's say, why it's necessary. Why do we need to know that the future, that if today there are 1,000 cases per day, based on this or based on the previous history, what will be the number of cases per day in 20 days? Why do we need to know this information? Well, how do you think the government or the administrations decide when to open the flights, when to open the markets, when to open the shops, when to open the schools? How? Based on the projection. They calculate, they analyze the possibilities, and then they try to project it based on the timeline. And well, that's how all these decisions are taken. So the idea is, well, I think I have received a question. What is the efficiency of using artificial intelligence to detect the basic health parameter? Well, this is interesting because, well, I must say that we shouldn't confuse smart devices with e-health devices, because there are a lot of devices which are certified as medical devices, as intelligent medical devices, which you can use at home to collect the data. There are a lot of smart such devices. So you might be thinking of some applications, like there are some applications where you put your finger on the screen, like on the camera like this, and it will tell your heart rate. Well, those things are not always very trustworthy. But apart from that, there are devices which are certified to analyze healthcare parameters. So they are pretty much reliable. So apart from that, the artificial intelligence and Internet of Things, it's very much helpful in the domain of drug and vaccine development. How? To identify biomarkers, to identify different healthcare parameters or values inside your body or outside your body, how they interact between each other, the chemical factors, the biological factors. You can consider everything. And considering everything, using the computational power of AI, it's definitely useful to help finding these drugs and vaccines. Or in whole, I would say the entire treatment phase is much better if we use artificial intelligence and in this domain of healthcare. I will show you a little bit of a case study, some practical aspect, how artificial intelligence really works in healthcare, or just an example. So this is about a project, or let's say